Hi, I'm Dr. Matthew Carey, and I'm a psychiatrist practicing at the Internal Medicine Group here at LMH in Lawrence, Kansas. I'm a native Kansan. I grew up in Manhattan, Lawrence, and Topeka, and very happy to be here and to be able to have the privilege of providing care to the community with regard to mental health needs. I think my medical training in internal medicine makes me fairly unique. There's only about 12 or 13 now accredited dual programs left in the United States. And so there are a precious few of us that are inspired by both disciplines. And for me, I think integration of care is what I bring to the table more than some psychiatrists do, simply because I'm inspired by knowing the patient's physical health status and integrating that into their mental health care to the extent that it becomes seamless. And as a medicine psychiatry resident, you're taught to view the whole patient. It's not just a brain, it's not just a nervous system, and in an era where care is so siloed and so divided between one specialty and another, I feel like as a tweener kind of, you can bring a whole different perspective to patient care. If you know about the patient's kidneys and their liver and their heart and their lungs, you can integrate that into their mental health care and maybe make different choices about what medications to use, sometimes what non-medical psychosocial interventions to recommend, and it helps you to understand the whole patient. And I've always said I'm a better internist because I have psychiatric training, and I'm a better psychiatrist because I have internal medicine training. It's what I call the moment. And the moment is when you feel like you've really made progress with a patient, and you've helped them understand something about them that they didn't understand before. And you can tell that they're deriving benefit from it, and you can see it in their eyes. I mean, it's inspirational. It's what gets you out of bed in the morning. To know that you've changed the life of a patient in a way that they thought maybe that couldn't be changed. A lot of people come to you in this discipline in a hopeless state, and to give them hope and to see that in their eyes, that's what really drives me every day. I would say that first and foremost, my philosophy is patient-centered. I want the patient to tell me what's important to them. I want them to bring to the table during the first few sessions I have with them what their problem is in their eyes, how they define it, how they see it, and most importantly, how it impacts their life and their functionality, and how I can try to best tailor the care to their needs. And the other aspect in terms of my philosophy of care is integration. Looking at the whole patient, understanding that they're not just a brain that needs to be fixed, but they're a whole organism, integrated, every organ system, on a journey to try to find wellness in the whole thing, as opposed to just one little aspect of care. And so I'd say those are the two driving principles of care that I probably define my practice by.